guys, it's Dr. Loeffler. I have Finley here with me today. Today, she and I are going to demonstrate all of the things that we check when your pet is in for a physical exam. I know sometimes it goes quickly, and I know both Dr. Minger and myself do a lot of our exam as we're interacting with you guys and talking to you and everything, so sometimes you don't even notice the things we're checking. So I just wanted to go through a little head to toe and show you everything we're actually looking for. I'm going to start literally head to butt for her just so that we can sort of cover it in an orderly fashion. So one of the first things we're going to do when we look at them, we're looking at their eyes. We're looking to make sure that their pupils are the same size and that they respond to light normally. And then nose, making sure there's nothing crusty, gross, no discharge, that they're breathing okay. She is a Frenchie, so she is supposed to be snorting as she is right now. That is normal for her breed. So knowing breed variations is really important for us because another dog coming in breathing like this, I would potentially be more concerned about. Then we're gonna come down and check in her mouth. We're gonna look at her teeth, her gums, make sure she doesn't have any broken teeth, signs of infection, growths in her mouth, anything like that. One of the other things we check is actually the breath and the odor from their mouth. So sometimes, specifically in kidney failure, they will have a distinct odor from their mouth that can tip us off even before we've done blood work or anything else that's potentially going on with your pet. Next, we're coming up to her ears. We'll look in both ears. We're looking to make sure that she doesn't have any discharge, redness, signs of infection in there. Also checking the actual outside pinna of her ear. Sometimes if they have things like mites, mange, we'll start to see hair loss, and this is the number one place that we see it. So that's one of the other things we're checking. As we're going along, sorry Finley, we'll feel under here. This is one of the spots where her lymph nodes are, and then I usually come and run my hands right here, right in front of her shoulders, which is spot number 2 for lymph nodes. So we're checking to make sure those all feel normal. Anytime they're enlarged, they can point to things as simple as infection in one area or potentially more serious things like cancer going on. Coming back down here then, next thing we're gonna do is listen. So I'm gonna listen on both sides of her heart. So you'll see us put our stethoscope under here. I'm not gonna actually listen in the video. Under here, both on the left and the right side. Murmurs in different places mean different things. So we're looking to see where that murmur is. And while I'm listening to her, I actually have my hand back here inside her leg, feeling her pulse. And I wanna make sure that as I hear her heartbeat, I feel her pulse in the back end. If that's not normal and going at the same time, it alerts me to different cardiac problems she could have. Then gonna come up and listen to her lung fields. So her lung fields are in here on both sides. We'll listen to both sides. Again, a little Frenchie like this that snorts, I'm gonna hear a lot of that noise in her chest. It doesn't mean it's in her chest, it's just that she has all that upper airway noise coming from there. But again, important to know the variations in breed and everything. Finn, I need you to stand up again. And then we'll do a little yoga apparently while we're here. Then I'm gonna come back and feel and palpate her belly. So I'm palpating all her internal organs, make sure she's not painful anywhere, that she's not wincing. You can see she couldn't care less, so that's normal. She shouldn't really be flinching or anything like that. I'm gonna come in, feel her pulses one more time. This time I'm actually feeling that they're the same from side to side so that both those pulses feel the same. Particularly in cats, sometimes if they have an issue with their heart, we'll feel that one pulse is a lot weaker than the other. Again, alerting to me potential issues going on. And I'm gonna come down, I'm gonna check their little butt. In her, it's easy because I don't have a tail that I have to move out of the way. Make sure everything looks normal there. I also tend to move the fur up here because this would be the number one spot that fleas or other types of parasites could be. So I'm checking to make sure there's no signs of it there. Come back down. Feel again some more lymph nodes back here, and I'm also feeling to make sure everything feels symmetrical back here. So if she was a dog with some chronic, a leg injury, something like that, I'll start to feel difference in their muscle mass, which will mean, again, we may need certain interventions and things like that. So that's our quick head to toe that we do on everybody. It changes a little. We look at paws, things like that, as they're coming in for limping, that kind of stuff. If I do a nail trim, then I'm actually looking at every individual toe and whatnot. Again, some depends on patient temperament. Not every patient lets me do this thorough of an exam, and so then we sometimes prioritize. If she would be coming in for limping, usually I'm gonna save whatever she's limping on for last. So I wanna do the most painful part at the end of the procedure so that then she's done and do the easier things first. When I initially come in the room and she's just hanging out with you on the floor, walking around, I'm checking to see that she's not walking into things, so it looks like her vision's good. Watching how she's walking, making sure she's not offloading weight a little bit abnormally on one of her legs that again could cause, alert me to some issues going on. Making sure her gait isn't neurologic in origin. So some dogs come in and they walk in circles or they walk into the wall, other things that can tip me off. So we do a lot. We pack it into a very quick exam, thorough exam. And again, I do these exams as I'm talking to you in the room. So sometimes I'm like, yep, we're already done. I usually try to engage owners talking while I'm giving vaccines because you guys get nervous and then they get nervous far more before them just getting nervous on their own. So I try to distract you guys a little bit as we're doing that too. And then sometimes I know I'm like, oh, we're done. And you guys are like, wait a minute, I think I just missed everything. So I just wanted to give you a little video of what we're actually looking for when we're doing our exams, because there's a lot we do that I think sometimes is hard to know and pick up on in the moment. Thanks, guys.